I'm with Dr. Teresa Frankovich. It's Friday, April 17th, and here are our media availability questions. How many hospital beds in the county is the county expecting to need for the COVID-19 surge, and how much extra capacity has the county added since beginning preparations?
So we've talked about this a little bit on the town hall and a couple videos. Baseline, the hospitals operate in our area with about 170 beds or so, and they've put in a lot of work looking at how they can structure things internally in order to be able to sort of fit beds in non-traditional places and do things like that. And with those things within hospital walls, they have been able to add beds to get us to close to 300 beds in our community, which is kudos to them for that. Obviously, with surge, the big unpredictable factor is really how many beds will we need. And the modeling is, which is something we're going to be talking about a lot next week, is giving us some guidance, but quite honestly, the range of need is vast. The predictions between, where we will easily meet our capacity to where we will exceed it, even with those beds. And so we're planning for the worst case scenario and that we will need those additional beds. And so right now we are looking at building capacity outside the hospital walls in non-traditional settings to be able to meet those needs.
Is there a concern that the COVID-19 pandemic is detracting from other critical health issues in the county, including the spread of hepatitis, needle litter, the opioid crisis, meth use, and spikes in STDs like syphilis and chlamydia?
So here in Humboldt County, just like in, I would say, the rest of the country, obviously it's a public health concern. We're devoting a lot of resources to COVID response, and that does make some aspects of programming difficult for sure. What I can say is that some of our basic routine operations continue. They have to. And so communicable disease surveillance for things like syphilis and chlamydia continue. Hepatitis, all of those. They're mandatory reported diseases, and we follow up on them just as we always have. And then the other issues around this, for instance, with needles, we know that the kiosks are still operational and in use, and the emptying of those proceeds, so that is helpful. But some of the prevention programming and messaging and some of that work that we would normally be doing really aggressively, yes, clearly we have to cut back on some of those things. And so but just to let people know that those core functions that are essential for public health are continuing.
Are employers obligated to allow essential workers to work from home when possible, or is that an optional course of action?
So the way we structure our order is that we ask employers for essential businesses to operate, embracing all the social distancing measures that we have outlined to the maximum extent possible within their workspace. We do know, we're sitting here today, some jobs are not really effectively doable from home, and we understand that. But we do expect employers to be looking at that internally, and where there is that possibility to maximally social distance by not having people on site because they can effectively do their jobs, that should definitely be a consideration for employers.
How many local COVID-19 tests are currently in a backlog pending results, and would this partially explain the recent drop in confirmed cases?
So here in the Public Health Laboratory, we actually report our results out essentially as we get them. Our turnaround time for testing is within 48 to 72 hours. And so again, there is no backlog for us when we have those results. We do report them out.
And how many of Humboldt's 52 known cases have been released from their self-quarantine orders?
So I understand this is a question that people are interested in, and our plan actually, we've been sort of looking at our internal processes to see how we can make this an easy number for us to provide on a regular basis for the community. So we are going to provide information on the number of cases removed from isolation, and I expect to be able to do that next week.
Excellent. Thank you so much.
Thank you.